Hello, everyone. My name is Angela Wonko, and I'm an MS3, and I'm co-chair of the Publications Committee. Welcome to the start of the Specialty Series. This series is a part of our Sowing Seeds program created by our National President, Osose Obo, in collaboration with the Alumni and Multicultural Affairs Committee. Throughout this long program, we'll provide resources on how to succeed as a pre-med and medical student, and we'll touch on everything from financial literacy to preparing for board exams and more. So make sure you're a national member by visiting the snma.org website and sign up to stay in the know. Now I will introduce our panelists for tonight. We're doing physical medicine and rehabilitation. Our first doctor is Dr. Benicia Williams, board certified in PM&R and sports medicine.
Hello.
Next, we have Dr. Emmanuel Achilike, a PM&R resident, PGY2.
Oh, do you want me to say hello? Hey, how are y'all doing?
Next, we have Dr. CJ Plummer. He's an assistant professor of PM&R.
Hello, everyone.
Next, we have Dr. Arlene Edmond, a PM&R resident, PGY4.
Hi, everybody.
And lastly, we have Dr. Annette Grother, a PM&R resident, PGY1.
Hi, guys.
Awesome. So we will get started. We'll just have our panelists share their personal stories, talking about where they trained for medical school, where you are now, how you chose PM&R, did you have any mentors in the field, and end with your favorite thing about the field of PM&R.
I can go ahead and start. So I am born and raised in California. I went to undergrad at Cal State Sacramento. I graduated in 2005, and I took 4 years off in between medical school. Before starting medical school, I actually did a post-bac program at UNT Health Science Center, and that's where I stayed on for medical school, UNT Health Science Center, TCOM. From there, I did a transitional year at John Peter Smith Hospital in Fort Worth and went on to train in PM&R at Baylor in Dallas. Then I did a fellowship at I went back to John Peter Smith and took care of Texas Christian University for sports medicine. They are a Division I Big 12 school, so it was very busy for my fellowship year. So I'm board certified in PM&R and sports medicine. My favorite thing about the field is the variety. You can really make PM&R into anything you want. There's so many different fellowships you can do. Even within general physiatry, there's so many different patients you see. You get to establish a lifelong friendship almost with some of your patients, especially if you're seeing spinal cord injury patients and traumatic brain injury patients. So it's just a fun field to be in.
Dr. Achilike, would you like to go next?
Okay, yeah, sorry, I'm a little slow. Hi, guys, my name is Emmanuel Achilike, like she was saying earlier. So currently I'm a postgraduate year 2 at Baylor College of Medicine. I'm from Dallas, went to undergrad at UT Austin, did my medical school, did 5 years of medical school at University of Texas Health Science Center, Houston, also known as McGovern Medical School. And I did my intern year at UT Houston, same as my medical school as well. So currently I'm just starting my PGY2 year. I'm at Baylor and, just, on the path to keep learning.
I can go next. I'm Dr. Grother. I actually am a little bit of a non-traditional student. I guess I'm not a student anymore. I'm actually a physician. I just graduated and started my transitional year in Aventura, Florida. I went to medical school at the University of Miami after taking about 4 years off and doing health research, global health research. I'll be attending my residency at Northwestern in Chicago. Very excited about that and learning the flow of intern year right now. I ended up choosing PM&R, and this is like a recent choice for me because of like some of the other panelists have said, the diversity of the field. I think of myself as kind of a creative person and an innovator, and I really wanted an opportunity to be part of an up-and-coming field where there's a lot of use of technology, there's a lot of opportunity for research. And then I did like the patient population. You get to work with all ages of people. You can kind of select your patient population a little bit more if you want to work with younger, healthier patients, or you want to work with older patients. You have that diversity and kind of that opportunity to make your practice very specific to your interests. So I really like that aspect. During my medical school training, I didn't have any specific mentors, but I really did try to get involved early and shadow people. And I think that's another one of the things that ended up drawing me to the field, is how friendly and amazing all of the people that I encountered in the field were. Like, I've not met one person who was not one of the nicest people I've met. So it's kind of impressive that everyone is really has that personality type, and it's very easy to get along with everyone, and it makes for a fun work environment. I think the last thing, favorite thing about PM&R, I think it's just like the opportunity to really connect with your patients. I think you have a very personal connection, and you get an opportunity to know them over a long period of time. And I think that's a really valuable experience as a physician. So it's a great field, and feel free to ask any questions specifically about interview season, because I know there's probably some people who are questioning about that or how to get involved in medical school.
Awesome. Dr. Edlin?
Hi, everyone. Hi, I'm PGY4 at Rutgers, New Jersey Medical School. I'm currently the academic chief resident here. I love it here, but I've taken kind of a circuitous route to PM&R. I actually initially, I went to undergrad. I'm a native New Yorker, Queens forever. I went to CUNY. Majored in psych, and thought that when I went to medical school, I really would go into neurology. I think the thing that really drew me to PM&R was that it's so patient-centered. And I think that more than any other field, you'll find, as Annette said, that the clinicians and everyone involved is really team-based and puts the patient at the center, and I love that. And I think that's true to this day. I did my I went to medical school at Zucker on Long Island in New York. And I did my intern year there as well in internal medicine. And I'm here at Rutgers now. I'm applying TBI. So that's kind of where I'm at in my journey. I really have, in terms of mentorship along the course of the way, I think that the PM&R department at my medical school really had a great deal to do with how I ended up here. Like everybody has mentioned so far, it's really a great group of people that tends to care a lot about their patients, but a lot about people in general. And I've been really grateful to have that along the way. My favorite thing about PM&R is just how many amazing things you get to see every day. You get to be a part of patients' lives in really critical points, and really build this lifelong relationship with them through some of their most difficult times. So that's something I really enjoyed.
And I'll go ahead. So CJ Plummer here. I am currently practicing brain injury medicine at Vanderbilt University Medical Center at our freestanding rehab hospital, Vanderbilt Stallworth Rehab Hospital. Brain injury attending on the inpatient service, and do some outpatient clinic as well, and occasionally consults. I'm here after completing fellowship in Seattle, Washington, University of Washington, and I completed that last year. And before that was in San Antonio, Texas, University of Texas Health Science Center, where I did my 4 years of residency. And then before that was at George Washington School of Medicine in Washington, D.C. So what drew me to PM&R was really, you know, I didn't have any experience with it or exposure to it at GW, but kind of stumbled upon it, and upon kind of doing some homework and research on the topic, it was really, or on the specialty, I should say, it was really just the focus on functional recovery. It was a new concept to me. I had never really thought about what happens to patients after their more acute circumstances and sort of how they get back into the community. So that was really interesting for me to see. And I just love the focus. My favorite thing about the field now that I'm in it is really just the team approach. I think I just love working in that team-based model to really try to focus on getting the patients as best as they can be. And just that longitudinal care, especially within the field of brain injury, where you're taking care of these patients long-term to just try to get them back to where they were before. And so those are, I think I answered all the questions. Oh, in terms of mentors, I didn't have too many mentors within the field in medical school because, again, we didn't really have any PM&R presence there. But as I transitioned into residency, had a lot of mentorship and benefited from that greatly, which is why it's one of my passions to provide that for others now. So happy to be on the panel.
You know what? I did not give a shout out to my mentor, if that's okay. I was lucky enough to learn about, I was a kinesiology major in undergrad, so I thought I was going to go to physical therapy school and change my mind. When I was MS1, I met my mentor, Dr. Omar Salad, who is now my partner. He has given me a job in his practice. He came into our class at lunch one time and told us about PM&R. He's like, you know, if you like neurology, you like anatomy, you have an upbeat personality, you like working with people, you know, consider PM&R. I was able to rotate with him as a third-year medical student. And then that was my very first rotation. I kept my open mind all year, but decided PM&R is what I wanted to do. So I got to rotate with him again on my fourth year. And then right before I went on my interviews. So big shout out to him. He's big on mentoring, which has inspired me to mentor my classmate in residency. We started a mentoring Instagram page called the Virtual Mentor Physiatrist. We actually just had Dr. Plummer on last weekend to discuss traumatic brain injury. And we just try to put out daily content and really just spread the word about what PM&R is. It's such a wonderful field.
I will follow up with that and say that's a wonderful page to follow. So if you're interested in PM&R, make sure you get on that. Okay, so we have our first question. How did shadowing work in medical school?
It's more you're working. I think in medical school, for me, you get your clinical experience from when you're a medical student. So my very first rotation with him, with Dr. Salad, I was going to go see patients. I learned how to do an excellent neuro exam, how to do a proper musculoskeletal exam. So that's how you get to, it's not so much shadowing as it is clinical experience. They call it your rotations. That more in undergrad, they call it shadowing.
Just to add on, I didn't really talk about my my mentors earlier, but I know one of my really good mentors is actually not a PM&R doctor. He's a neurologist. So I have a couple mentors, Dr. Afejika, Dr. Smart. And I met Dr. Smart through Dr. Afejika. Dr. Smart, he's a Black male neurologist. And when I was a third year and I was interested in PM&R, one of the things they did to help me, you know, get a little bit more experience with, you know, anything related to the musculoskeletal system and the nervous system is Dr. Smart pulled me from my neuro rotation, made sure that I was on his team. So whenever I was like having questions about anything, you know, I would always have like a personal session with him within our rotation, you know, so that I could get clarification on things that I had questions about. So it was kind of great having your like attending be that invested in you as well. And I think one of the biggest takeaways from that is sometimes one of your best mentors isn't always in PM&R, but wants to advocate for you to do better. And if they have a way to do that, they can help push you in that direction.
I think you bring up a great point. There's a lot of ways to get involved. I think One way, especially if you don't have a PM&R department at your school, so when you're on your rotations, make sure to tell all of your attendings and residents that you're interested in PM&R. A lot of them know what it is, and they can point you in the right direction for people that you might want to talk to, or they'll just point out clinically relevant patients or opportunities for you to get involved in a more peripheral way. And then also just Googling people. I think it's a great, like in medical school, I had some time in the afternoon some days where I would just go to clinic and work with whatever attending, whatever resident I hadn't met yet at my school or even at private clinics. So that's a great way to get involved and shadow, or you can also do formal rotations. So in 4th year, you have the opportunity to do away rotations or elective rotations. Those are really helpful because they often give you a lot of autonomy, and you learn a lot of really important clinical skills. And you might be able to do some of those as well in 3rd year.
And I would also recommend, if your school does not have a interest group, start one. We started one when I was in medical school as a 1st year, and it's grown into a pretty big group now. So you can do that through a PM&R or AAP and usually be associated that way. And then you can also get mentors involved through both of those organizations.
Yeah, for me, I kind of talked my way into a away rotation at National Rehab Hospital when I was in DC. The only PM&R pain provider that was at GW left right as I was supposed to be starting. And so I ended up just reaching out. I used the PM&R interest group to get in contact with the attending who was the sponsor for that group. And then he allowed me to spend some time with him doing cancer rehab there, and then they let me spend some time on the inpatient service. So that was really how I ended up kind of making that happen for myself.
Awesome. Okay, so Zucker is one of my top choices. How is it being at a fairly new medical school with such a clinically focused curriculum?
So I think I want to start by saying I know that it can be scary going to a relatively new institution without a really long history. I was a 3rd graduating class from Zucker, but they had a very structured curriculum that was kind of based off of the new teaching styles that had been implemented by places like Mayo, and I loved it. It was very active throughout. And it's been shown that, you know, people have been adopting it kind of across the country. It was very different in terms of learning style from undergrad, kind of sitting and lecture. But I really enjoyed it. I would highly recommend it, but I would take that with a grain of salt because I'm clearly biased.
Okay. Is anyone using a portfolio like oslercommunity.com to help build up their profile at med school?
I think all of us are out of medical school, so that isn't relevant.
Okay, this one says, thank you for all your time. For someone that got interested in physiatry later in their 3rd year of medical school, what are ways to show programs that you are genuinely dedicated to the field, even though you don't have that much exposure?
I'd be happy to take that one. I actually initially started in medical school. We had clinical exposure pretty early on, and one of my earliest clinical exposures was family medicine. And this family medicine clinic was a patient-centered medical home. So basically, it was a team approach to caring for a patient, which I really, really enjoyed. But the subject matter didn't necessarily completely spark my interest. So I found an interest in, I found physiatry relatively later on. I think that the consistent things that are important to being a physiatrist, you know, making sure that the patient is at the center, being willing to kind of take a team-based approach and highlighting those threads throughout experiences, whether or not they're directly related to physiatry, could really be helpful if you feel that experiences are not necessarily available to you. But somebody did mention earlier that, you know, you can do electives during your fourth year. So that is something I'd recommend if it's something that you're genuinely interested in.
Yeah, someone who just went through the process and also started pretty late. I originally was between PM&R and OB, so very different fields, and I had to focus more on OB earlier in medical school. So third year, I kind of got more serious about shadowing. So meeting people in the field. If people know who you are, they're more willing to help you as far as letters of recommendation go, as far as giving you opportunities to jump on papers. So I started doing more shadowing third year, and then early in fourth year, this is all before applications were due. So like from the beginning of fourth year to application due date, I just jumped on a bunch of case reports. I think I published 3, and that ended up being something that people were impressed by when I was on the interview trail. I also kind of highlighted my volunteer activities, and some of them kind of related to PM&R in the sense that they were related to like physical therapy or just doing outreach. Like I think those sorts of activities, if you're involved overall, you can really highlight those and highlight yourself as a strong, empathetic, caring person. And that's equally as important as your application showing that you've done PM&R, PM&R, PM&R. So kind of doing a combination of those, I think would be a great way to start.
I totally agree. And unfortunately with COVID, I know a lot of programs are not allowing as many outside students coming to rotate. So something you can try to do is email the program directors and see if you're able to sit in on a lot of them are doing virtual didactics right now, and see if you can just sit in the virtual didactics, take notes, be active, ask questions. They'll remember your name. They'll remember that you took the initiative to try to be part of their virtual didactics. So just showing some interest will help that way.
Is there any advantage or disadvantage to categorical versus advanced residency programs in PM&R?
Somebody answer what that is. I've talked a lot. So. Dr. Plummer.
I can speak to this a little bit. Advanced versus categorical. I don't know if everyone knows, but you know, you do your intern year and then you also do your advanced years. Your PM&R years tend to be your PGY 2, 3, and 4 years, whereas your intern year is your PGY 1 year. Some programs have them combined. Some programs have them combined together and some have them separate. I'm at Baylor right now, and that's just 2, 3, and 4. Whereas I was at UT last year, which was my intern year. I think there's advantages because you kind of get acquainted with your hospital system a little bit better if it's a combined program. Whereas you know, me jumping systems, even if it's in the same city, I'm relearning a lot of stuff related to hospital systems, getting access, and redoing a lot and how the institution functions in different hospitals I'm going to work at function. So I think that would be the main advantage. You know, I think other things like getting to know your faculty earlier would be the main advantage I would see in terms of being with doing just a categorical, like doing a combined program as opposed to doing an intern year somewhere else and then doing a 2, 3, and 4 program.
Yeah, I that's exactly what I was gonna say. You know, I ended up doing a categorical program, and yeah, a lot of the benefits that were just mentioned are the things that I can speak to. You know, just being able to sort of be in. The other thing is that it's just one move as opposed to 2 separate moves, but so that can be a cost saver. It is helpful to be in the same place with the same system, although it will still be a pretty decent learning curve once you transition over to PM&R, your PGY 2 year. But and then every program's sort of designed differently. Some of them will, like here at Vanderbilt, our residents spend like almost 10 months on internal medicine, versus for their categorical intern year. Where I trained, it was more of a transitional year where we did like a couple months of ortho, a month of neurosurgery, rheumatology, just related fields that you'll work with very closely once you're in PM&R. So every program's a little different, but yeah, I can speak to some of the categorical advantages.
So I ended up doing a transitional year. So if you do an advanced, you can do a transitional or a prelim year. I ended up choosing a transitional year because we had a lot more opportunity for electives, and it's like a little bit less intense, and I have a lot of other extracurricular things that I'm trying to do. So it was kind of a personal choice. So I definitely recommend you kind of take all of these things with a grain of salt, because it's definitely going to be different for everybody. Those are some of the reasons why I chose transitional year. I also got to stay in Florida for one more year before going to Chicago, which is super cold. So that factored in for me. So thinking about location of these programs, the transitional years, especially, a lot of them are in random places. So you may want to just end up being in the city that you're going to end up for residency, or maybe you want to try to be in one place for 1 year and see what it's like. So it definitely is a personal choice, and feel free to ask more about that decision if you're struggling with that.
And I can clarify just a little bit too more about the intern year. So the intern year, it could be a prelim internal medicine year, you can be a prelim surgery year, or you can be a transitional year, which is typically a combination of both. But like Annie said, you don't typically have to do maybe ICU. I didn't have to do ICU, but I had to do trauma surgery. So there's pros and cons to both of those. And there's pros and cons to each and every single one of those specialties you choose. So choose wisely, apply broadly. You will be doing twice as many interviews, because you will have to interview for your PM&R at the same time as interviewing for your intern year. So it can be a little bit more expensive. So that's another advantage of doing categorical years. There's only 18 categorical programs in the country out of 120 PM&R programs, if I remember off the top of my head. So there are not that many of them, but they're worth looking at.
Okay, so our next question is, what is the difference between neurology and PM&R, since there seems to be some overlap in the diseases that are treated?
We're more fun. No, I'm just kidding.
Yeah, I can jump in on that one too. So because I actually thought about doing neurology as well when I was kind of coming through the process. I think a lot of the differences lie in sort of when you're catching the patients in their acute injury, whether it's traumatic brain injury, stroke, or whatever it is. And so, I thought about neurology, and a lot of it is more diagnostic in nature. Certainly they do awesome work in terms of treatment of some of those things, but in terms of the long-term care needs, the longitudinal care needs, you're really going to get more of that in PM&R. So I think an important difference is just where in that trajectory you're catching the patient. And certainly we're involved during the acute process as well, but we really end up taking over the care after they've made it through that acute process, whatever it may be. And then sort of helping the community reintegration and the directing of the therapeutic modalities, PTLT, speech, whatever it is that they need. And so, managing some of the secondary effects of these injuries, spasticity, increased tone, some of the different things that can happen. And so I think that's probably how I would define the differences. As a brain injury specialist, I work very closely with the neurology service. We very often, I'm sending them referrals, they're sending me referrals. We work kind of together to try to take care of these patients. So that's how I describe it.
I think one of the biggest differences I've seen, you know, I'm fairly new into the field, you know, I'm a PGY2, but I think even the thought processing and how neurologists do things versus how physiatrists would do things is a little bit different. Like we're about function, about a lot more about what works for the patient, whereas, you know, the neurologists tend to be a lot more, I guess, medicine-y with it, like, you know, very strict and, you know, we're going to follow the rules by the guidelines and, you know, very, you know, wash, rinse and repeat. Whereas a lot of times we're a lot more, what is going to work for this specific patient, you know? And also, you know, like they were saying the where we get them in terms of the acute and the more chronic and long-term management and things like that.
And to piggyback on that, our job is very much, and I think almost every physiatrist will tell you this, is to maximize patients' quality of life and improve their function in any kind of way that we can. If it's doing it by medication, if it's doing it by a Botox injection, if it's doing it by ordering any kind of DME, an AFO, a KAFO, which are different type of braces to help patients walk better, if it's ordering a specific type of wheelchair. Neurology is very much based on diagnosis and getting the correct diagnosis. We work hand in hand with neurologists every day. And once you have the diagnosis, then we kind of step in and help with the functionality of the patient. I will say this, there's a lot of physiatrists that do EMGs and nerve conduction studies, and neurologists also do that for physiatry. We are required to do 200 EMGs before you're able to graduate from residency. That is not a requirement for neurology. And a lot of people don't understand that we are probably, a lot of physiatrists are board certified in EMG as well. So they are experts at diagnosing that. But there is a lot of overlap with neurology and PM&R.
I'd like to jump in. I think that as a medical student, it can be really confusing to try to understand physiatry as a field. I completely agree with what everyone has said. And I think the thing that seems to resonate with medical students when I speak to them is that, you know, physiatry is not just one thing. I think it most closely resembles neurology for several reasons, but I think of it as kind of multiple Venn diagrams of overlapping with multiple things like orthopedics, orthopedic surgery, we're a non-surgical specialty, and rheumatology, internal medicine. But at the center of all of that is the patient and how we can best kind of serve them with our range of skill sets from EMGs to modalities like heat and stretching and things like that.
How important do you think research is when you're applying for a PM&R residency?
I'll answer that one. So, you know, and certainly things change. So, you know, please, for the folks who just went through it, you all, I definitely would love to hear your feedback. But as someone who went through it, I served as administrative chief resident when I was in residency. So I was a big part of the evaluation process for our potential residents, and still pretty involved here at Vanderbilt now. You know, I think a lot of it just depends on where you want to be. Certainly, there are some programs that seem to have more of an emphasis and focus on research and how much you've done. To my knowledge, you know, I haven't come up, and I've interviewed at a lot of programs, and I've been a part of that process. Like I said, to my knowledge, I'm not aware of any program that has that as a requirement. It certainly can enhance your application, but there are certainly several other ways that you could continue also enhancing your application to stand out. And so, that's what I'd say about it. I mean, I think that sometimes I have just found that students that I've mentored become very stressed out if they, you know, or get approaching the tail end of their medical matriculation and haven't had a whole bunch of research. But I would not view that as a deterrent for applying for the field. So if you're interested in it and you want to get involved with it, that's great. But focus on really presenting a whole application that's competitive.
Yeah, so when I went through the interview trail last year, I really think that what you said rang true. A lot of programs did not care or ask about any of the research I had done. A lot of them would ask about research I had done in other specialties just out of curiosity. And then I had 3 publications that I put together somehow in 4th year. And those were asked about quite a bit. And I think it was more that I had put those together. Like, a lot of people don't have any research in PM&R. So it was more like, oh, wow, like you have 3 papers in PM&R. That's very impressive. As opposed to being like, oh, like that's standard. Oh, good. You check the checkbox. So I think if you have an opportunity to jump on a paper, it will look really good. People will be impressed, but it's definitely not a requirement. And people seem to be very receptive to research that was done in other fields. So maybe if you had other research, maybe you changed your mind along the way, that will be well received, I think. And you can kind of just explain why you changed your mind and why you're interested in PM&R now. People were really open to hearing those sorts of comments and those sorts of explanations, because I think a lot of people do discover PM&R late, and program directors are very understanding of that situation, and really kind of try to assess your genuine interest. So if you can demonstrate that through whatever capacity, you'll be in good shape, I think, for interviews.
One thing I had a couple of research projects I had that were very incomplete whenever I applied. Like, I had this project over here about opioids and spinal cord injury, and this other project in ventilators and spinal cord injury, but none of them were complete. None of it was complete. It was all like works in progress. So I can't say definitively like whether the attempt mattered or not. I think it matters because it shows how interested I am. But I didn't have any like solid publications or great presentations when I was applying. They did ask me about what I put on my CV, which was the attempts, and they would ask me about that here and there. But I didn't have anything definitively published whenever I applied.
What advice would you give to a second-year medical student who's interested in PM&R?
Oh, I guess. Can you guys hear? I thought I was muted. Sorry. I would say get as much exposure as you can. I know in the COVID, it could be difficult, but if you can find someone that you can try to shadow and get that experience, that will be helpful. Getting research projects, like we kind of talked about, I think he's emailed me before, and if you could try to find somewhere just to, even if it's just data entry and get your foot in the door, that would be remaining. You're already ahead of the game by knowing about PM&R as a MS2, so any kind of exposure you can get now is just, that's the best thing you can do.
I ended up doing a lot of informational interviews, which I think will be really valuable for people, especially now during COVID times. It really, like, I still to this day learn new things about PM&R, like what you can do, what the scope of the practice is. So I think the more people you talk to and learn like what they're doing, the more articulate you'll be when you're on your interview trail or when you're speaking to other physicians, the more impressed they're going to be by how much you know about the field, because a lot of people know very superficial definition that maybe they read about on like Student Doctor Network or like Reddit or something like that. And so having had those conversations with people will help to build, first of all, your understanding of the field, and then help figure out what you're interested in within the field. And being able to communicate that, I think, will really be an asset to you as well.
Yeah, I was gonna add, making sure that, as you're transitioning into the clinical years, that you're really trying to optimize each rotation. The interesting thing about PM&R is that you will end up using a lot of the knowledge you build on almost all your other rotations in some capacity once you're in PM&R, because we especially, like, so for example, on the inpatient service, we're getting all kinds of diagnoses from, and I think I'm sure most of us have probably taken care of at least one patient from every specialty in some capacity. And so just really trying to soak up as much knowledge as you can while you're going through that process. And then the other thing I would say is, don't really try to seek out, try to make connections with folks within the field that have an informed opinion about the field. Sometimes when you're mentioning it to attendings or residents from other fields that don't know anything about PM&R, I have heard, it hasn't really happened to me directly, but I've heard other students say like, oh, this person said something negative about this field or that field. And I find that happens just across the board. The surgeon may be making fun of the non-surgical fields or vice versa. So just really try to filter out, and get a true understanding of what the field is as you're expressing that interest.
Do you all collaborate with physical therapists on the multidisciplinary team? If so, what does this relationship look like?
So I can hop on this a little bit. So I think that the closest relationship at times can really be on the inpatient side. And I guess examples are helpful. So I'll do my best. So on the inpatient day, we'll rotate and see the patients on our rounds. And the physical therapist may say something like, I was trying to walk with this patient, but that was difficult because they have increased tone. Is there anything that we can do about that? And we'd have a discussion with the therapist about what exactly was limiting that patient's ability to walk. If there are particular muscles or particular patterns that we can see, and do our part kind of on the medical end to optimize them so that they can kind of get the best out of therapy. So we work with the therapists, occupational therapists and physical therapists relatively closely on a day-to-day basis.
We also typically have team conference. I had a team conference today on my, I go to a long-term acute care hospital and I meet with the therapist and talk about every patient on my list at least once a week. So it's very much a team approach. It was a physical therapist there, occupational therapist, and a speech therapist. In residency, we were lucky enough to also have neuropsychology. So at least once to twice a week while you're on inpatient, you will have a team conference that is required for insurance. You have to submit a report to insurance, and then they will let you know how long you can keep your patient. But yeah, you work with them every day. They give invaluable advice.
I remember. Okay, next question. Never mind. Okay, now I'm gonna say I remember. I just finished my intern year, started my PM&R year, so I haven't been on an inpatient service as a resident now. But I do remember from my my fourth year med school rotations that they had multidisciplinary rounds. And not only were they working with the PTs, but the OTs, the speech, language pathologist, the nurse, everything. And I think one of the biggest things was, like they work closely with the PTs, but as well as everyone. And I think having these different perspectives from different people on what's going on with this patient in order to best serve them is always like a big thing that I thought was really cool.
Thank you all for hosting this and spending your time with us. Now that away rotations are not feasible for this year for a majority of MS4s, some programs are providing virtual electives. How effective do you think those experiences will be for us? And also, how does one get a feel of the programs when we can't visit them?
I know I'm talking a lot. I'm very passionate about this. As I said earlier, I started with my classmate, Sheena, from Residency, the virtual physiatry mentors, and we kind of foresaw that this was going to be a gap in February and started this page. So what we have done right now is different residency programs are taking over our page every day. So yesterday, Baylor in Dallas, where we went, took over our page, and the residents got to kind of showcase who they are, show a little bit about their program. Today, the University of Minnesota is taking over a page and doing the same thing. And then on Friday, University of San Antonio is taking over a page. And we have a bunch of different programs that are set to take over and to be able to show their program, because that is a big decision. When you're deciding where to go to residency, you want to know who you're going to be working with and if you're going to fit in. So hopefully that will help, because it's tough for you guys. I feel bad.
I'd like to jump in here. I know that this can be kind of incredibly difficult, and I think this might vary from program to program. But I think that if a program offers like contact information for residents or for their administration, I'd really take them up on that. I've spoken to a few different people over the past couple of weeks, and I know that this decision can be really kind of nerve-wracking and difficult. So I would hope that the residents that you speak to would be kind of open about what they feel their program has to offer to help you make that decision.
That's actually something I did during my investigation of programs, because I felt like there wasn't a ton of information available on how programs were set up, what the perception of programs were. And then, I mean, obviously there's a question of like how friendly they are to diversity, what the patient population is like, at least for me personally. So I tried to contact physician or one of the residents at each of the programs I interviewed at. Sometimes I got to speak to multiple. And I think it really did correlate with what I ended up thinking about the program in the end. Like if you're talking to the person on the phone and you guys are clicking, that can be a really good sign for how the program, maybe the culture of the program. So I would definitely recommend that.
I don't know, I didn't go on a whole bunch of interviews, but I always remember that talking to my people who were also applying was a great source of information as far as what was going on with this program here, this program there. PM&R people, we're not generally cutthroat or anything like that. So I never thought the information I was getting was coming from a bad place. But I think, talking to each other as well as, the residents of the programs you apply to. And, I don't know if all of y'all know people who are applying, but, I was fortunate enough to have people I knew who were also applying, and, kind of getting their feel for places here and there was always a big help.
I'll just add real quick, I mean, and I definitely want to be sensitive to the challenge that COVID-19 has presented. One silver lining in it, though, is that you really are getting to meet quite a bit more people at a lot of these programs than I know I did before I applied to a lot of them. So, I mean, even previously when people were doing away rotations, you still weren't doing a whole lot of them. And so a lot of the programs you were still having to, just kind of apply, get an interview, sort of see what it is and see how it's going. What I'll say is, I just capitalize on all of this information that a lot of the programs are doing through programs like Venetia was saying, that she's established. And, there's the programs are very, very active, become very active on social media, Twitter and Instagram, and posting these things. And so that I would say, trying to also get a sense of what's going on with the programs through their social media presence. And then like all of you have pretty much mentioned, is reaching out to the programs and asking about what kind of opportunities you have to maybe sit in or Zoom in, I should say, on a didactic session, or who you can talk to, whether it's the residents, the chief residents, if there are attendings that are interested. I'm always interested in talking about those types of things as well. So yeah, just capitalizing on all of this extra information. I just used to have to read through the website, and a lot of times they weren't up to date. They were old and hard to navigate and stuff. So yeah, I would do that.
Another really good resource is PM&R Scholars on Instagram. They've been hosting weekly residency fairs, and they have probably like 50 residencies that have signed up to do this. And I believe that they save the stories onto their YouTube page and Instagram TV. So that's another resource you can check out to get to know programs.
Do any of you have experience with osteopathic manipulative treatment, and is it used in PM&R or taught in residency?
I'm probably the only DO on right now, so I will take this one. So you have an opportunity to use it in residency if you want to. You can kind of make it what you want. I didn't use it that often, but I did. My junior behind me, he was actually in my class for a year, and then he took a year of just doing OMM in medical school. So he ended up being a year behind me in residency, and he integrated it a lot into his practice in residency. So I think most PM&R programs are very DO almost every program is DO friendly and open to OMM if you want to do it, but it's typically not taught in residency.
I talked to someone on the phone, Dr. Ugochi. She's like in regenerative medicine, and she said that she was using her OMM abilities. I'm a MD, so I don't do it, but she was telling me that she would actually do it inpatient, and her attendings would bill for her ability to do the OMM. So she was bringing, a new skill set to, her team whenever she was on those teams. So it definitely has use.
Yes, Ogochi is one of my best friends, and yes, she is very good at it. She is very good at it, and she still does it today. She is fellowship trained in regenerative medicine and interventional spine, and she still does OMM on almost every single patient before she does any kind of intervention in it.
I just want to make a small point, if we can, before we move on. And in our didactic sessions, I'm an MD, so I'm going to preface it with with that. As Dr. Williams said, PM&R is very much a DO-friendly residency program, but I think that it varies also. There are particular programs that, incorporate it into their didactics for all of their residents, my program included. So very, very, very basic things. And it's always very much appreciated.
That's wonderful.
Okay, our next question. I noticed that 2 of the panelists have MPH, and I'm currently a 4th-year medical student who's taking a year off to get my MPH. Just was curious, how do you plan to use that degree in your practice?
I can start. So I was at University of Miami. They have a really cool program for anyone who's not already in school where you can get your MPH and MD in 4 years. So I ended up during medical school starting a program that's basically community-based. We go into barbershops, do preventative screenings for hypertension for minorities. I say that to say I hope to expand that sort of outreach, potentially utilizing like community healthcare workers to address like mobility issues and access issues for people with disabilities. So that's one way I kind of anticipate incorporating my MPH. I think just thinking of like hospital systems, how they can function better, just the overall picture of your patient care, how patients are like transitioning through different areas in the medical system. I think the MPH really helps with that. So just as far as like patient care, I think you have an advantage in that sense. And then there's also opportunities to go into administration. You can do public health research. A lot of people do like injury prevention research if they have like an MPH. That's one way people can get involved with PM&R and the MPH.
I think for me, I have a BS in public health, and I knew I was going to get an MPH, whether I did medicine or not. My goal was always to, go past, patient to patient care and have a bigger picture, whether I was working for a health department or doing something like that on the side. I think one of the biggest things for me, people always want me to, quantify and quantify why it matters and how, and what it does for me. But I think one of the biggest things that I noticed earlier is the fact that I think the way I think about my patients is very different. even when I was just starting third year, I think immediately whenever they would come in, I would immediately see what happened in the community, what's going on in the community that led them to be here at this point. So for sure, I think the very fundamental thing that it does for me is it simply has always made me think much more differently. Like you're here because of a long line of things that happened to you before you got here. Like, you know, so for sure my thinking is differently. And I think in the future after residency, I hope that I can, you know, do something that's more community based and, you know, help out people on a larger scale as opposed to just one at a time.
Okay, and this will be our last question for the night. Are there any specific questions you would advise to assess a program fit, especially in this interview cycle?
I think that's a very personal question. And I spent some time sitting down and I went through, there's a couple of books on like residency application process, and they kind of help you brainstorm some of the things you might find to be important in a program. For me, my main focus, I wanted to really work with diverse patient population. So I always asked about that. Always check with the residents to see how they, like if they look happy, first of all, and if they have anything negative to say about the program, I think that's a big red flag, because I think people are usually on their best behavior in these sorts of settings, and they probably are holding back more. I also think that there's kind of, there's some programs that are more focused on academia and some that are more focused on just like clinical practice. I think you're going to get great training at either type of program, but that may be a personal thing for you, where if you are interested in being and attending at an academic institution, some programs really cater to that, and some are more focused on like practical application. And then I guess opportunities to get involved early, any sort of like volunteer programs or like auxiliary programs they have to serve the community. That was something that was important to me. If residency programs weren't really active in their local communities, that was something that I tried to screen them out with. Those are just some things that I had thought of, but definitely I would spend some time brainstorming things that are super important to you and make sure to have a list at hand so you don't forget anything when you're asking your questions.
I think the list idea is for sure like a very good idea. And also whatever you think about or notice whenever you do visit a program or talk to a program, write it down so you remember it later. Because when you're trying to compare them all, you know, I don't know how it might be difficult to remember everything. Just a personal story. I remember I had one interview and I remember, you know, diversity is very important for me. I remember like their incoming class was like white male from the same school, white male from the same school, white male from the same school, white male from the same school. And then like an Asian girl. And I was like, oh man, this is off. I don't know if I can do this. And I was like, I don't think I can do this. And I mean, you know, I gave him a chance and it was a great program, but you know, I just remember that threw me off. It threw me off.
I'll add, one of the things that I tried to ask programs about was sort of what areas they were working on improving. Sometimes when you ask them what their weaknesses are, you won't, sometimes you don't always get the most honest answer. And so a way to sort of disguise the question is what are areas that they're looking at improving? You know, because to me, that was certainly the strengths of the program are very important based on what your goals are professionally, but it's also important to think about what you're not willing to deal with or what's just a no-go for you. It kind of reminds me of advice my dad gave me in dating, just sort of identifying the things that are definitely like red flags. You're not dealing with it. You're not tolerating it. And sometimes that can actually be, I won't say a more important question, but that can be a very important question when you're looking at these programs. So I would say that I definitely agree with getting a sense of how the residents look, how they talk about their program, how they talk about their attendings, especially from a teaching standpoint and a support standpoint. Looking at if there's history of diversity, you know, those are, or if there's any kind of what type of support is available for minority students, especially, I mean, we've all known all of this stuff that's going on in the world, but, you know, especially with this kind of awakening that, if you will, just really getting a sense of what type of support is provided for students would be another one, or for residents, excuse me.
Some other questions you can ask is what their board pass rate is. What do they do for the residents to help prepare them to take their boards? Because PM&R, you take a written board and you have to typically fly to Mayo in Rochester and take an oral board, but that I think is changing because of COVID. You can also ask if they are supportive of residents going to different conferences. You can say, hey, if you've had residents that have gone into fellowships, what fellowships have they gone to? So that can kind of let you know if they've matched into it and if they've been successful.
Awesome. Well, thank you again to our amazing panelists. We really appreciate your support of SNMA and our membership. For those of you in the audience, we will have you scan a QR code on the screen. This will also be located in the chat. So we just want you to give us some feedback as we work to create more useful programming for you all. We also want you to check out the See Us campaign on our website. Thank you again for joining us. I encourage you guys all to follow us on Instagram. Check out the upcoming specialty shows. We have a full calendar planned. Follow us on Twitter at SNMA, like us on Facebook. But most importantly, if you're not a national member, please visit snma.org to sign up and get connected. Thanks for tuning in, and I look forward to seeing you all at our upcoming Sowing Seeds Specialty series.